Hey humans, how's it going? Susan Ruth here. Thanks for listening to another episode of Hey Human Podcast. This is episode 125. I sat down with Dr. David Teplica when I was in Chicago, Illinois. He is a world-class plastic surgeon and fine art photographer, philanthropist. He is a researcher. He is one of the foremost researchers on twins. Fascinating guy, fascinating conversation. I'm really excited for you to hear this one. Just a shout out, anybody, if you're on Twitter, please tweet to me. Let me know you're listening to the podcast at my Twitter, which is Susan Ruthism, SUSANRUTHISM, or tag Instagram, Hey Human Podcast. Let me know that y'all are out there listening. That's at Hey Human Podcast. You could hashtag it too, I suppose, but the at least, then I will for sure see it. Usual stuff, Amazon portal on the heyhumanpodcast.com website to do your Amazon shopping. It helps support Hey Human. There's also a support button on the Hey Human Podcast page as well, on that homepage. Your support is wonderful, and it really helps keep the podcast ad-free. Check out the link page on heyhumanpodcast.com. I keep it updated every week with tons of information. And fun fact, I have known Dr. Teplica, David, for a very long time, as we talk about in this episode. And I have been a model for him in a million different photo shoots and various medical lectures he's given. I have played the part of musculature and such. We talk about a little bit on this episode. But there is a book that he put out a handful of years back called Intimate Decade. And it is a book of many fine art photography images that he took. They are beautiful. And I think I have 3, 4, 5, something like that, pictures in there. So that's kind of fun. I'll put a link to that as well. You can email me, Susan at heyhumanpodcast.com. I'd love to hear from you, as always. And follow me on all the social media, Susan Ruthism for, again, Twitter, Hey Human Podcast for Instagram and Facebook. Last but not least, please rate and review on iTunes and wherever you get your podcast. Thank you for listening, and here we go. Dr. David Teplica, welcome to Hey Human.
Hey.
Thank you for being on the show.
Thanks for having me.
I'm very excited. I have known you, I think, around 18 years or so. Maybe, is it longer?
Oh, man.
It's been
What year did I meet you in Seattle?
I want to say I was thinking about this yesterday in preparation, and I think perhaps it was around 2001, 2002-ish, because I can note moments in my life by who was in my band at the time. And so, I remember particular band members, and then I know kind of around what year and what year albums
I have some fun photographs, and I could go back into the computer and try to find them. And
so you are a world-class plastic surgeon, a world-class photographer. But I don't say that lightly. People fly in from all over the world to see you, and your photography is in museums all over the world as well.
Yeah. And now also, my research interests are really flying. It's pretty neat.
I'm going to move the microphone just a scotch closer to you because you have that lovely low altitude baritone, whatever men have. What is
testosterone. That's what we have.
In lots and lots.
I mean, maybe not so much in my case. I've been a very lucky guy with a surgical career that's really hit its mark, and having a lot of fun with that. My creative photography, which of late has merged into a lot of scientific stuff. Those techniques have been applied now to studying and trying to understand the human body and the genetics of anatomy. It's really neat. And so, the big push right now is research, and we're making some very, very cool groundbreaking discoveries. It's been a blast since I saw you last. It's been almost exponential in how it's exploded. It's fun.
So where are you? What's the latest thing? I'm not sure the best course is to start maybe in the middle and go then to the beginning, or would you prefer to talk about what inspired each moment forward?
There's a fun little story of discovery that I could probably ramble about.
Wonderful.
And then bring it up to the present. I should probably give your listeners a little bit of a background. For my entire life, I've been doing the arts and the sciences. I had a dad who was an architect, a mom who was a nurse, and so I was learning anatomy at the same time I was learning to draw and paint, human anatomy and figure drawing and all that kind of stuff as a kid even. And really had a neat childhood wallowing in both sides of my brain. Got to college, was able to design my own major to study the human system through the arts and the sciences. Off to medical school, where I received art scholarships to go to medical school, which was really pretty funny. Doing my anatomic drawing and photographing the body and, studying the broader impact of humans and anatomy.
And historically, you were one of the first surgeons willing to operate on HIV patients. Is that not true?
True. Came a little later. Let me just finish one little loop here, because I was recruited to the University of Chicago, which is an intense academic place. And basically, you're asked from the time you arrive what your Nobel Prize is going to be in, right? And I was asked that in the first couple days that I got there. I just thought that was so odd. But I ended up getting a research couple years, and my research advisor was a Nobel laureate, one of 2 surgeons who's ever won the Nobel Prize. And part of what I was doing was learning how to transplant different tissues around the body. Not to save somebody's life by giving them a new kidney, but to get one individual to feel whole again by using their own tissues transplanted within their own body to feel whole again. It started off with bone, and then it became very clear that I really was much more interested in fat volume, the shape of the body. I was very lucky to have 2 years in the laboratory while getting a Master of Fine Arts, and then went off on my own surgically here to the north side of Chicago. But I graduated in 92, which was the peak of the AIDS epidemic, right? And so all around me were these HIV positive individuals whose bodies were wasting away, and their faces would look like skeletons, even though they were surviving and, otherwise pretty darn healthy, except for the HIV issue. But they looked skeletal. They looked grossly deformed.
Because part of HIV is facial wasting.
Yes, because the virus kills the fat cells of the face. And so you end up being skin on skull. And it is a bizarre look for humans. But I used my exposure to the transplant stuff in the lab at the University of Chicago to figure out how to transplant fat from elsewhere on the body, fat that was not dying because of HIV, back into the faces of women and men with HIV facial wasting. And that launched a whole experience that's allowed me to really think about, human shape and fatty volumes that make us look healthy, or that make us look female, or make us look male, or make us look young or old, right? Or how to restore people who've had trauma, or how to take somebody with birth defects and make them look like a normal human being, because you can shift volume around the body by transplanting living fat cells. I was doing this in 94, 95 to the great dismay of my colleagues and fellow surgeons who thought I should have my license revoked and would say that to my nurses. It was pretty bad. But I felt very good about trying to help the HIV population initially, and then some of the other populations as the years passed, to help people feel whole again. And it worked. It was pretty cool. I'm very proud that now, 24 years later, it is the hottest topic on the planet. Fat grafting is worldwide the hottest thing in reconstructive medicine and in cosmetic surgery, because we now know that the face shrivels for fat volume as we age, especially around the eyes and the mouth. And that's why people look hollow and wizened and all those other adjectives that we use to describe old age, right? Mm. The witch's chin is just a little chin with the fat gone from around it, so it looks like a little ball chin on grandma, right? That's from fat loss as we age. So it's a pretty neat thing, and it's gotten a lot of attention in the last few years. I'm a relatively unknown guy in that world because I haven't self-promoted all of that. And my patients, especially the HIV patients, don't want the world to know that they have HIV because they can look healthy again and nobody picks them out of the crowd as the HIV wasted woman. And so I've just kept, what I do relatively quiet over the years. But those techniques have, served me well for shifting everyone else without HIV back to a place of happiness and comfort. So that's one area of my life, where the arts and medicine have interfaced. And it's been an incredibly rich and rewarding thing, and it continues through to the present. We now use it to make wrinkled faces look youthful and healthy again. We use it to make women with breast cancer have normal-looking breasts again. It's used for birth defects, trauma defects. If somebody wants to shift the way they look for gender, then that can be done also. Mm.
So feminization of a male body or defeminization of a
person who sees themselves as more masculine, exactly. Mm-hmm. Or because of life's hormonal shifts that happen, a woman who goes through pregnancy ends up looking more matronly because certain fat pads grow in response to pregnancy. And then that woman can't ever work out and look like her old self again because of the hormonal burst in size of very specific fat pads that happen to consistently enlarge in most women who go through pregnancy. Or a woman who goes through menopause ends up looking like an older woman because of the hormonal shift that happens later in life. It turns out that men go through something that we still haven't officially named, but it's known either as andropause or menopause, right? Because we don't have a uterus that stops bleeding doesn't mean that we don't have hormonal changes at about the same time in life. And if this weren't, a podcast,
you can say whatever
I
you
might
want.
be able to show a couple of my own body parts to let you know.
Oh, I see what you're saying, yes.
To let you see what devastating things happen to men, right? I used to have a lovely chest and belly, and now I am feminized. I have some lovely breasts, and I've got a little poochy feminized lower belly. It's fascinating. And as the one studying these fat pads and how they change over time with different influences, it's very humbling, and it's kind of a little reassuring to know that it's not because I didn't go to the gym enough or because I ate the wrong stuff, Yeah,
I think that's I've seen a few of your lectures about this particular thing, and I remember having conversations with you about, you told me that even marathon runners, like Olympic marathon runners, could have cellulite. Or I remember that changed the way, I believe most of us have a body dysmorphia of some sort or another. But
you're lovely, my dear.
But it certainly changed the way I understood how the body worked.
Right.
Which was very empowering.
Right. Which sort of brings up the next topic, which is that my research team and I have come to the point where we're developing this whole concept of anatomic predetermination. You are who you are because of your genetics. And you can't do anything environmental with diet or exercise to change your body shape. That is a renegade idea. Because everybody believes, of course, when you diet, you look different, right?
Right.
But it turns out that is a size change, not a shape change. And that we can all function within our shapes and modulate our size by eating more calories or eating fewer calories, but you're not changing your basic shape. And as soon as you relax on your diet, you go back to whatever the size was that you weren't happy with before, with the exact same shape that you had prior to dieting. And so my research group and I have proven that body shape is genetically encoded using an identical twin model, and we can talk about that a little because that's pretty cool stuff.
Very cool.
Using identical twins have shown that your body shape is genetically encoded, but that you have some control over size. So if you can go to the gym and exercise and eat right and get your size down, the size of your fat down a little bit, and be happy, great.
Because the cells expand and contract.
Right. If you can shrink them down so that you're happier with smaller fat cells, great. If you can pump iron and get your muscles to be bigger in size, no different in shape, so that you can feel better about your body as a guy and not be insecure, great. Do that, right? If you can modulate both to get your size down for fat and your muscle size up for volume, and feel good about that, awesome. But as a plastic surgeon, I can tell you that I see the hardest working, most dedicated people on the planet when it comes to body maintenance, who are woefully unhappy with how they look. And if you're killing yourself at the gym and dieting constantly, that is not a fun life, especially if you're not ending up with a shape that's happy for you, right? And so if you have a shape that is not what you want, your only choice is surgery, because environmental influence does not modulate shape, as we've determined with this identical twin research model that I started way back at the University of Chicago when I was, I don't know, a third my age, a long time ago. Initially looked at the faces of identical twins. It's highly standardized photographs of identical twins.
Explain what that means.
So, we just take snapshots of each other or selfies on a day-to-day basis. Those are not standardized images. Those are cool little views of the way somebody looks given a certain camera and a certain set of lighting and a certain set of emotions expressing on your face. But you can actually do scientifically standardized imagery where there is no movement. The camera is exactly the same number of millimeters from the face, the same lighting for everybody, the same lens, the same, digital cards, the same everything. So that the only variables in those photographs are anatomic variables. And so we've been able to study the faces of twins by controlling all of those other variables. And I'm very excited to tell you that we proved that twins' faces are the same, or they are exact mirror opposites.
And these are identical twins.
Identical twins. We're not talking about anybody else.
Yeah.
These are monozygotic twins that came from one egg, monozygotic. If you have proven that a pair of twins is monozygotic from our research, then their pores will be in the same places, or their wrinkles will have the same characteristics, like branching patterns and all that kind of stuff. Their acne erupts in the same place at the same time.
Or mirrored.
Or all of that stuff is exactly mirrored. Now, are they in the exact same places? No. We also learned that we realized that during embryologic growth in the uterus, that perhaps depending upon nutrition, the size of the placenta, that kind of stuff, that certain features will migrate different distances within embryologic segments on the face. So, for example, all faces are made up of 3 somites, 3 segments. And if the middle segment, which migrates forward, toward and around and under the nose, doesn't come all the way to the front and fuse, then you get a cleft lip. And the clefts are examples when migration and fusion don't happen correctly. If you account for the fact that you can have little skin lesions in different places within the same segments of the face, then almost 100% of everything can be found on the twin. Or they are in the exact mirror opposite segment. Nobody thought to look at this in the past. And we have statistics that are frighteningly significant, like 10 to the minus 15th. Like you'd have to have, I don't know, what is that? 1,000 Earths worth of people in order to have it happen by chance. So it's not left to chance. Your anatomy is genetically encoded because there's nothing in the environment or your diet or your exercise routine that can create mirrored moles in your twin. It just can't happen. It's illogical.
There's a story that you told me many years ago about in Twinsville, or
Twinsburg, Ohio. Yep.
Twinsburg, Ohio, and there was a set of twins, female, and the cancer on the ear. So fascinating.
Yes. So we've shown that benign skin things like wrinkles and pores are the same. We've shown that physiologic processes like where your sweat droplet forms or where your acne forms is the same as your twin. And in this case, my first little discovery of tumor formation was a pair of twins from Texas, where one woman developed a pigmented basal cell cancer on her left ear. And a year later, it was discovered by me, that the twin had the exact same tumor in the exact same location on her left ear. And so there may actually be predetermination of where your tumors are going to form at age 70 or 71. But of course you don't see those until later in life, right? But if it's in the exact same three-dimensional location in your twin, for that to happen by chance is almost zero.
And so it happened in the one woman just a year later.
Well, no, because in the second twin, it was a huge tumor. So it had probably been growing for at least a year, but nobody thought to look at the twin ear to see if she had the same tumor, because we don't think that way in the world of medicine, right? Mm-hmm. So clearly it had been growing for an extra year and ate a bigger chunk of her ear.
Wow.
And since then, I've identified pre-melanomas, dysplastic nevi, in the same or mirrored positions. I've identified breast cancers in the same or mirrored positions. So there are potentially some very big implications for this work. Mm-hmm. Because if we know that a mother had a breast cancer in one breast, and we know that anatomy can be passed down to her children, whether they're twins or not, passed down to her children either in direct fashion or in mirrored fashion for the exact location of that tumor, then we can predict where the daughter might have cancer and save her life long before maybe even the cancer gets to cancer.
That gives me the shivers.
But it's very cool, and it's very humbling, because physicians don't think this way, that there could be predictive strategies for the three-dimensional location of diseases. We think of tumors as being random, but it's quite possible that a nest of cells that has the potential to devolve to cancer has been there since long before you were born, and just sits there for 70 years until suddenly it takes off.
Yeah.
In the exact location it was supposed to, happens to be the exact same location that your identical twin had her breast cancer happen. So we're not ready to declare that as 100% accurate yet, because we have to get more cases to make the tumor part of this statistically significant. But if your large pores and your branched crow's foot wrinkle crease and your pigment patch, your little age spot, is all the same as your twin, why would we imagine that other anatomic things weren't also going to be three-dimensionally predetermined? Mm-hmm. So it's a potentially very important and valuable little finding.
It's extraordinary.
It's pretty neat. But then we took that information. Nobody believed me. They just all, give the big fancy keynote address to the World Congress of Twin Studies, and nobody believes me, right? Because it's not, he's just talking about zits. Who cares about zits, right? We're just talking about wrinkles. We want to talk about real stuff, right? So I decided I had to prove the point by doing a different study, which was to look at the shapes of twin faces. And it turns out that twin faces are identical for shape, using some cool photographic digital subtraction techniques in Photoshop. They are exactly the same for shape, or they're the exact mirror opposite for shape. And interestingly, if the shapes of the faces are mirrored in twins, then their moles will be mirrored in every case. Mm-hmm. If the faces of the twins are identical, so that you can overlap them and they look like one face, then their moles will be on the same sides. Their wrinkles will be located in the same way on both sides of the face. So it appears as if anatomy of the face and the skin are in agreement with each other all the time. That was very exciting for us. So we decided to then study body shape. And we're able to prove with twins that your body shape is also the same as your twin, or the exact mirror opposite as your twin. And if those twins were mirrored for body shape, they were also mirrored for facial shape. And they were also mirrored for their moles and things, their skin lesions. And so everything seems to be in agreement. And you are born either in a certain way from your parents or in a mirror opposite way from your parents. Twins allow us to see that.
So you're saying that people who are not twins, like I am either a mirror or an identical replica of...
You are who you are three-dimensionally based upon your parents' anatomy, or for whatever reason, you were born as the mirror genetics of whatever your parents exhibited. And we're trying to figure out how that happens and why that happens. We've proven that it's not a function of when the egg starts splitting and dividing. We proved that in Belgium with a very brilliant woman named Catherine Jerome, a PhD researcher in Belgium.
How do you prove something like that?
Well, because of the anatomy of the placenta, we know when the egg of the twin pair split to become two people. We know whether it was an early split or a late split. And it was always postulated, it was always thought that the late splitting twins were going to be mirrors of each other. But we proved that that's not the case. So there's something inherent in the DNA. And I don't have that figured out yet. And I've got all kinds of little ideas about it, but we're not ready to start speaking publicly. But there's something about probably the way the DNA copies itself or breaks into its half components as sperm or as unfertilized eggs that means that you're either going to be the exact replica of your parents from that side of your family, or that you're going to be the mirror for the anatomy from that side of the family. And that combines with whatever comes from the other half, the sperm of the egg. And you end up being perhaps identical to mom and mirrored of dad, or whatever, right? But this is a brand new field, and nobody's ever looked at this before. So it's a pretty neat thing. And we're using photographic and visual techniques to do the baseline research, looking at anatomic predetermination. And the data suggests that you can't change that with your habits. You don't take care of yourself, you could still look like a stud. We know plenty of guys who never go to the gym and look amazing. And plenty of guys who go to the gym all the time and don't look amazing, right? And the same for women. It's not about that. It's about who your parents were. Now, I'm not advocating that you don't take care of yourself. I think for your heart health, you should do cardio. I think if you want to keep your muscles strong and your bones strong, then you should be doing some weightlifting. But if you think that that's going to somehow change you over time, my data suggests that you're wrong. Does that make sense?
Yes, completely.
So it's a whole paradigm
It's
shift
fascinating.
in the diet and exercise world. And it also allows people to accept who they are anatomically, right? And so maybe you don't waste 10 or 15 years with, protein shakes and killing yourself and blowing out your shoulders and knees with too much exercise, or ridiculous flies, to try to get your chest bigger, and then you completely screw up your rotator cuffs or whatever, right? Maybe we should be doing heart healthy, joint healthy, bone and muscle healthy, routines. And if you don't like the way you look when you're at a steady state in a healthy routine, then get surgery earlier, so that you can enjoy your adult life and not have to kill yourself by, taking anabolic steroids or some of these horrible things that people do with the false hope that they're somehow going to change their anatomy.
And I thought there was something that really interesting that you brought up, and I know this is a little off topic, but then brought up in yours and my conversations in previous conversations about how plastic surgery, there's the issue of they just say, oh, woman or male, and I'm just going to carve you into the shape I know, and because predominantly women were the ones getting plastic surgery, that it resulted in the feminization of male bodies.
Yes.
And I thought that was really interesting.
Well, remember that my field has historically been older, white, heterosexual, Protestant males who were then charged with the idea of making women feel more comfortable with themselves and with their male hormonal balance, probably thought that meant increasing femininity in all the women who walked into their offices. And all of the techniques, almost 100% of the techniques, are designed specifically to feminize. Or they're designed in a way that does not address the issue of gender. And so if a guy comes in and wants to be masculinized, he's either going to be made neutral or he's going to be made feminized. And you have to take active steps to shift somebody, a male who feels feminine with man boobs or with fatty hips that happen to run in the family, right? And if you just do liposuction on that individual, you're going to create a flat chest and a curvaceous waist. And you're not going to take out all the hip fat because you wouldn't do that in your female patients, right? And there's really been no dialogue about gender differential surgery that's gendered, right? And so I see guys from all over the country who yearn for some masculinity. They're not going to talk about it on TV or in public. Guys do not talk about insecurities about their own bodies, right? Women will speak to each other in a pretty open and honest way about that stuff. You're not going to walk into a locker room and have a guy, say, hey, have you, ever had plastic surgery because I'm insecure about my man boobs? They're not going to talk about that. And so they're not going to talk about it with a male plastic surgeon either. They're just going to say, yeah, I don't like these man boobs. And then the surgeon will say, all right, come in on Tuesday, we'll take care of that. But there's no protocol. There's not a lot of dialogue about how to intentionally masculinize form and eliminate feminine traits. Very little. Because of our fat pad research that I was telling you about, we are actually sitting in a pretty cool place right now to be able to consistently masculinize men who want to be masculine, potentially to masculinize women who see themselves as men, or who see themselves as lean, athletic, masculinized women. I believe in embracing it all. I believe in talking to the patients about how they see themselves and how they want the anatomy to shift, especially from a gendered point of view, so that we can get the highest satisfaction possible from surgery. But it means that you have to be anatomically pretty creative. You've got to be able to identify the fat pads that feminize, identify the fat pads that changed because of hormonal influence, and shift things so that the person's brain more closely matches the way they see themselves, more closely matches the way they exist anatomically, so that everything's in concert. And that, I think, is really the way we should be going. But there's very little dialogue about this stuff right now.
I remember you gave a lecture in Utah that I was a model for. And it was a lecture about this very thing, and you took Sharpie pens and drew all over me the musculature and
you did survive, right?
I did survive.
You survived,
yes.
yeah.
Yeah. Although we were going to do it, I remember, because I was going to be nude. Well, I think because it was a lecture to nurses and doctors, and I remember the hotel, because we were in Utah, flipped out and insisted I wear a bathing suit.
Yeah, we were told that even though it was a private session with locked doors, that we shouldn't have nude models for a medical lecture.
Right. So found a bathing suit. But explain that about the drawing, because I think that's really neat.
Yeah, in order to get to the data, in order to get to the understanding of the human anatomy that we really haven't looked at this way before. CAT scans and MRIs do a wonderful job at determining the anatomy on the inside of the body. But they're all done horizontally, flat, right? So you can't look at the shape of the body from an MRI or from a CAT scan because gravity's been shifted 90 degrees. So we can't make any judgments about fat pads or fullness or shape or how people are perceived in society based upon those technologies. So my team and I have developed rotational photography of the surface of the body using the visible light that a camera normally captures. And that's allowed us to study form and shape and document it for the research records. But then in order to figure out what is just beneath the surface, the fat pads, that are what are really the gendered anatomy that we look at on a day-to-day basis. When I look at you, I see a lovely young lady, but that's because you have feminine fat pads in the correct places for your gender. And I don't mean to be judgmental by saying correct, but for what society deems logical for perceiving feminine form.
Well, and how I see myself.
There you go.
There you go.
But the only way to document that is to pinch test by pinching the fat off the surface of the underlying muscles. And then that thickness has to be mapped onto the surface of the body. If your listeners want to see, there are some examples of these kinds of pinch mappings on my websites.
Yeah, and I'll put links on the Hey Human podcast webpage.
Awesome.
Yeah.
So both for the foundation, where we do all the research, and for the surgical, implementation of that strategy and how to make people more happy with their bodies. So the bottom line is that there is a series of colored pens that are used to map the underlying anatomy onto the surface of the body, and then that information can be used for research purposes, or it can be used to transform somebody to a place where they would rather be for their anatomy. So that's another whole limb of what we've developed over the last 15 years or so. And it's really played out in a neat way. And we're now getting some pretty cool insights. And getting patients to transform and feel comfortable with themselves without using a cookbook approach to surgery. Every single patient is individualized according to their own wishes, which is really pretty cool. And I would suggest that's probably the better way to go, rather than to just cut here and stretch there and tuck this and sew that and whatever, right? It'd be much better to be able to finely carve each of the fat pads to match the aesthetics of what somebody wants for themselves. If somebody has too much feminizing fat and a woman wants to look somewhat less feminine, then we can do that now. If a woman doesn't have enough fat in certain locations, instead of using implants, now you can actually transplant the fat from elsewhere on the body and put that where she might like it. Guys who look soft and ill-defined in their own minds can suddenly look masculine and chiseled and angular. I'm sorry, my tummy.
I think that was my stomach. Maybe they're talking to each other. They're having a little conversation.
They're having their own little. So it's a technique that can be used in personalized ways to get body shape that isn't cliche, that isn't charged with social baggage, right? I'm not out there just hyper-feminizing every woman who comes along. And I'm not unintentionally feminizing guys by using the same techniques. So it allows for, really individualized care that can take care of any gender or how anybody sees their gender with no presumptions. It's pretty neat.
Are you seeing many transgender patients?
I'm in an awkward position because I'm practicing at a Catholic hospital, and the hospital is not super excited about shifting gender. I've had to make a very, very difficult choice to stay on at that hospital, but I'm doing it because the hospital actually was the first in the Midwest to put in an HIV/AIDS ward, and they have a great commitment to caring for the HIV community. And so even though I'm disappointed that we are not allowed to really deal with issues of gender so much, I do have a safe and welcoming environment for my population, small population. It's about 20% of my practice, but the HIV community is not necessarily welcome in very many other hospitals, even to this day. So I'm making sacrifices so that the majority of my patients get quality care that's honorable and decent and safe and secure and all that kind of stuff.
Does the protocol for working for surgery on someone who is HIV positive, is it a completely, I imagine, the same with if you had to operate on someone with hepatitis, or is it just...
Well, I'm very proud that two colleagues and I published a paper back in 1992 on how to operate on HIV and avoid needle sticks and avoid transmitting HIV in the operating room. Because it became clear that you had to do something so that people wouldn't get stabbed with needles and all that kind of stuff. So we published a paper way back, and I'm very proud that got picked up by the World Health Organization and the CDC and all kinds of other places as suggestions for how to avoid transmitting disease in the operating room. But remember that nowadays, almost all HIV patients in America, at least, are treated with antiretroviral drugs and have 0 virus particles circulating through their bloodstreams.
Yes, it's really changed the game.
Yes, and they don't die, and they don't transmit the disease, and if you operate on them, you cannot get infected. And you operate on some other person who hasn't even felt a need to get tested, and they could be wildly out of control with virus particles for HIV floating through their bloodstream. And if you're not using protection that's the same for yourself and for everybody else in the operating room, then you're setting yourself up for transmission from the non-HIV population, at least the ones that we don't know have it.
Right.
Am I making sense?
You are.
So we should be thrilled to operate on HIV patients who are treated, and we should be scared as heck to operate on people who haven't been tested. And so I think it's ridiculous. I don't think we should be discriminating against anybody. If anything, I think we should be very open and upfront about it and using precautions for blood transmission on 100% of patients who have surgery.
Makes sense.
And those same issues apply to just general population for people who want to have, cosmetic or plastic surgical interventions. And the data that was derived from the HIV population can now be used to benefit the general population for understanding different fat subpopulations, for understanding fat transplant, for understanding what makes a face look normal again. How do we, because all the HIV patients, all the women HIV patients end up looking like men because all the feminine fat of the face goes away. Wow. So we can understand gender of facial fat from that population. And we've started work on that topic also. Fun stuff.
It's fascinating. So, there's the sirens are going by. One other thing that I wanted to talk about before we move on to the next bit, back with the mirrored and identical twins, I know, at this point, I know about 7 sets of twins, 3 sets in Tennessee alone, where they are, where one twin is homosexual, either lesbian or gay, and the other is heterosexual.
Mm-hmm.
Is there something about the twinning that is that?
There is something about. I don't think it's about the twinning, but it speaks to the fact that sexuality is probably pre-encoded, and that people can't really choose. Now, of course, I've known that for years. As an openly gay guy, I am quite certain that I would never have chosen to be gay, right? But then at some point you realize that it's actually kind of a cool privilege, and that
You are fabulous.
Oh, how many F's?
Lots.
But a very brilliant researcher at Northwestern, Michael Bailey, showed that there's a much, much, much higher chance that if one twin is gay, then the other twin will also be gay. And so there is a genetic component to sexuality. I can't quote the details of that research. We're actually probably going to get at some answers to this eventually, because we're studying anatomy, and there are anatomic correlates to sexuality. So, for example, I've noticed in a very high percentage of men who we've studied for their body fat, if they declare themselves to be bisexual, then it's very common for them to have the focal fat pad thicknesses of both genders. So there may be pre-encoding of fatty development and brain development at the same time based on hormonal environments of the uterus or wherever, right? And that would explain gaydar, which is a fascinating thing, right? You look down the street and you say, oh, that's a masculine woman. She's probably a lesbian, right? Well, you're not looking at her sexuality. You're not talking to her to hear her voice. You're not talking to her to find out what she's obsessed with sexually. You're looking at her anatomy and making a judgment about sexuality.
And the plaid shirt. No, I'm kidding.
Well, why would you wear a plaid shirt, right? It's pretty fascinating.
Absolutely.
But listen, I have women patients who come in for plastic surgery, and the complaint is that they cannot fit into any feminine clothing from any single female clothing store. Why? Because they have the muscle mass or the fatty volumes of men. Now, if I went into a woman's store and tried to buy a shirt, there isn't a chance in heck I'm going to fit into any one of those items of clothing in that entire store, right? Because I have more masculine anatomy. Perhaps not as masculine as I might like, right? But
I'd say
I don't know
you're
how many...
masculine.
Thanks.
Yeah.
I don't know how many women have come in and expressed concern that they have to go and shop for their clothing in men's clothing stores because their anatomy was masculine. Mm-hmm. And so gaydar, when we look at somebody and make a decision about their sexuality, is probably in large part intuitive, anatomic perception. And that I look down the street and I see something that looks more masculine than I would expect for a woman, or looks a little more feminine than I might expect for a guy, or looks a little more prepubescent or adolescent for a guy who is what we would now call a twink, right? Sort of softly feminine. Not terribly masculine, not terribly feminine, right? But just something in the middle, and maybe adolescent in shape and size and all that kind of stuff anatomically, right?
An Adonis, the sort of...
Or the Adonis who has... Well, women, for example, don't normally have love handles, okay? Very uncommon. If a gay guy has the masculine traits of not having feminine fat pads, and then has the feminine trait of not having love handles, then he is a V-shaped masculine guy, more beautiful than the average straight guy, studly body, right? Mm-hmm. And so we're just scratching the surface on this stuff, but it's quite possible. This is all pre-encoded.
Yeah, and it's the supermodels, these women that are, they're beautiful, stunning, but there's something androgynous about them. And
are you talking about the XY testicular testosterone insensitivity, so that they're actually men who look like women.
No, I'm talking about supermodels like Giselle or Elle McPherson. Are these
They're
women?
probably triple X females.
Is that okay?
Yeah.
I know that there's like an extra chromosomal something going on that
triple X females.
So they look sort of masculine and
taller than average,
feminine.
somewhat masculinized,
but in that very angelic way.
Right.
And even the Fibonacci thing, it's weirdly matched up with these people also, the perfection of the face.
Yeah, I have never aligned with that. I have difficulty putting geometric and proportional, algebraic proportions to human form. But I respect people who want to look at that. I would rather look at the actual anatomy and compare the fat pad thicknesses for these different groups. So anatomy may be encoded from your genetics and then altered slightly in the uterus. And if it happens at the time that the brain is differentiating from a sexuality point of view, then your external anatomy may represent your sexuality, so that people can perceive your sexuality by just looking at anatomy. We know that it's not 100%, but there are certainly trends that we all see on a day-to-day basis.
I remember, and I might be remembering this wrong actually, because memories are funny that way, but did you once tell me that the breast tissue, there's some behind the knee or something? Or was that, am I wrong about that? That you said that once?
No, and then we're about to publish this, so maybe I shouldn't even talk about it, but what the heck. We've identified that there are two separate types of yellow fat, and that because of the HIV population, we've identified that there are mounds of remnants of breast fat that run down the front of the body from the armpits down to the groin. It's called the milk line in the embryo, or the mammary ridge in mammalian embryos. And the little fat pads that grow almost like tumors in HIV patients are in the exact locations of teats in lower mammals. And so we have pockets of breast fat in the locations of mammalian teats.
Oh my God.
And those little mounds are what determine the shape of the body that allows us to see gender. Yeah, it's cool stuff.
Holy moly.
There's more of that to come. We haven't published the manuscript's about 95% finished, and that should go out in the next probably 6 months. But
does any of your research cover the people who...
Chimeras.
Chimeras, that's how you say it.
People who have two separate sets of genetics in one body.
They think it's a fusing of twins or something? That's how I've read the research.
Yes, it's believed that you have two embryos that are fraternal twins that then fuse and combine, and you get a mosaicism, sort of a scattering of cells of the two different people in one body. It's very rare. I'm not going to study that probably in my lifetime, because I'm not sure I could ever come up with enough study samples to be able to make any sense of it. But, I think we'd be able to extrapolate information after I get my data on just basic anatomy, and then you could make some extrapolations to help understand that population a little better. But my group and I study normal anatomy. We're studying what is normal. And that hasn't been fashionable in anatomy since, for probably 200 years. It was always called the dead science when I was in medical school, because it was thought that everything that could be known about gross human anatomy, like big structures of human anatomy, had already been discovered. And sure enough, we come along with digital imaging technologies and photography with visible light, and we're finding all kinds of stuff, like these new fat pads that nobody knew existed before.
Why do you think you are so interested in twins?
You had to go there. I had been studying twins for about 4 years when the president of the Twin Foundation that was supporting my work, the Center for Study of Multiple Birth, Donald Keith, came up to me and said, "So how come you're so interested in twins?" And I said, "I don't know, because they're visually fascinating or something." I don't know what I said. And he said, "Are you a twin?" And I said, no, I'm not a twin. And he said, why don't you go ask your mother? And I said, why would I go ask my mother? And he just said, why don't you go ask your mother? And so I did. And she turned white. And she said, I never thought you'd hear this, but I was told I was pregnant with twins. And then in the 4th month, I passed blood and tissue and clots and probably miscarried your other half.
And you did not know this until you were a grown man.
Until I had been doing twin research for 4 years.
Yeah.
Well, it turns out there's actually a scientific paper that looked at this issue, and I think the researchers showed that 85% of single birth people like me who align themselves with twins happen to be from pregnancies where the mother had heavy bleeding at some point in the pregnancy, probably miscarrying the other twin.
That's fascinating.
So the Chicago Tribune writes, basically, doctor searches for dead twin with my studies. I mean, she's all pretty silly, right?
Wow.
I don't think it's hocus pocus. I don't think it's ESP. I think, if you're primed to be curling around some little fetus in the uterus and then suddenly somebody takes away your buddy, then, maybe you feel a loneliness, a longing, right? And actually kind of get a little jealous and happy and excited when you see two identical twins who are so inseparable, right?
Yes.
So I don't think it's a spooky thing, but there's clearly something there because we see it all the time.
Yeah, I would say the connection is certainly one to point.
Will you be my twin?
Sure. Speaking of twins wrapped up amongst their loveliness, your photograph of twins, the twin children, babies that are on the cover of Wally Lamb's
book. I know this much is true.
And then your photography is stunningly beautiful, and you've done, of course, work with twins, obviously, for this work, but your fine art background, you have an extraordinary body of work of the body of work.
I think that made sense. And thank you very much.
Yeah, when we met in Seattle all those years ago through mutual friends and fell madly in love and have been friends ever since.
Don't tell them that we're in love.
I'm in love.
Oh.
And you, may I speak of this? I became someone you would photograph with other people. So we did all these great photo shoots, and we happened to be naked. And
I wasn't naked.
You were not naked, and it was not sexual. But talk about that work a little bit, just because it's so beautiful, and I have many of your images, and I just think they're extraordinary.
Thank you. I really think we are way too paranoid as a society about the human body. We all have the same stuff, and yet because of paranoia or Judeo-Christian guilt or self-loathing or insecurity, or because of the history of objectification of the female body, right? I mean, all this stuff is bad. We got to just get over it. I mean, it would be amazing if we could just look at and revel in the body in a way that was responsible and joyful and not condescending or not overly titillating or whatever. It would be amazing.
I have to tell you that the first experience I had, actually it's the second experience, because the first experience I had being photographed by you was with another mutual friend of ours, who I won't mention just because he's not here to say it's okay. And then after that experience, I came to Chicago to do another photo shoot, and this time it was with a room full of people I had never met before. And my feelings about my own body at the time, I mean, I was 6 foot at 14 and gangly girl, and then, whatever, and then the concept of how you see yourself and all that stuff. Marfan, so I already had all these weird sort of things. And I remember being nervous, so nervous. It was really important for me to do it when you said, come do this if you are interested. And I leapt at the chance because I thought it would be really good for me. And I remember being there in the room, and everybody has their robe, and then you say, all right, robe's off. And I remember being scared, and not scared like scared I would be hurt or traumatized or anything, but just, that vulnerability moment. And I disrobed and I was standing there and I was thinking, oh my God, I'm going to get judged by these people. And it was all different shapes and sizes, the men and women in the room. And, I was kind of sneaking little peeks, but trying to be respectful. I know, but, just because, you're wrapped up with these people because of the way your photographs are, you become quite entangled. And I remember by the end of that shoot, marveling at how my mind went from, oh my gosh, I'm so funny looking, or this bit's too big or too small or whatever, and to seeing all these different body types and thinking, my God, it actually makes me emotional. It's everybody was so beautiful. And
so different.
And so different.
Right.
There were people that were, some were slightly, what might be considered overweight, some were underweight, some were, more masculine and more feminine men, all that stuff. And everyone was so lovely and beautiful, and it completely changed my life.
Yeah. Oh, good. You're not the first person to say it. I hear this all the time, right?
It was really beautiful.
Thank you. Yeah, I hear these transformation stories. I have a woman right now who, as a younger woman, had eating disorders, couldn't see her body as a lovely thing, and got recruited to come up and do one of the science projects to look at the breast fat along the mammary ridge, where we're grid mapping the body, by the way, in XY axis, and it's fascinating. So that you can actually bring statistics to the shape of the body, which is pretty cool. I think some of those images are on the website. And she left here with such an understanding of her own body and how it was genetically predetermined. And then she asked if she could please jump into the creative stuff. And so we did. And now I get this phone call every 3 or 4 weeks that she has to come back from very far away to do it again and do it again. And she's recruiting people. And now it's like what eating disorder? Like, I don't have an eating disorder. It's like she's been cured from this psychological thing that can be so devastating for women and men.
Yeah.
And is transformed to love her body now, which I find totally fascinating.
Yeah.
Part of the issue, I think, is that you're curled up with these people and you don't really know where your own body starts and the other person's body ends and so all of a sudden it's just like you're part of humanity instead of being this isolated being with anatomy that isn't right or something.
And there's a beauty that comes with that kind of vulnerability as well, because you really, hard to be more vulnerable than being naked in a room of 20 people.
Probably true. Did we really get 20?
No, they're
What a great idea. Yeah. Any listeners who want to be part of the big naked group?
I think the most I ever photographed with was maybe 8.
Yeah,
I want to say somewhere around there. Anyway, I just wanted to bring that up just because it was such a wonderful change.
Well, thanks for sharing that. I think it's important for people to realize that embracing the body, and wait, that's maybe not a good verb, but the idea of wrapping your head around the fact that your body is in the context of a much broader society with all shapes and sizes and colors and ages and states of disease and health and all that kind of stuff means that you're really part of humanity. And then it's impossible to be objectified or to objectify yourself if you've put yourself into the context of the broader human condition.
It still slips in here and there, but mostly, it's hard to get out of our own way sometimes.
But it's a very rich thing, and it would be so nice if the world could just drop a lot of the baggage about bodies.
I agree.
It'd be amazing.
Yeah.
Stop objectifying women quite as much. I'm not suggesting we objectify men more, although that seems to be happening, which is fascinating.
Yeah, it is.
There are now buses with rippling abs going down the streets of Chicago. It's pretty funny, actually. But instead, to treat the body for both men and women as, anatomic and functional and appropriate and let's talk about that in a meaningful way rather than just the horrible tits and ass crap of the past. Maybe I shouldn't have said tits and ass.
They've heard worse on this show.
They have?
Absolutely.
Then I'll go for it. No, so that's sort of the broader mission of my life and work. A lot of the creative photographs are really about allowing people to see, what contact is really all about. What does it look like when dark flesh presses against light flesh? What does it look like when male flesh presses up and wraps around male flesh? I mean, these things aren't beautiful. These things aren't horrible. They're not threatening.
Right.
They're beautiful.
There's some lovely, you have a suckling image of a baby and mother that is really so beautiful.
Thank you.
And a lot of the fingers and toes interlacing and just, it really takes on this multi-layered
Well, all the imagery is meant to be, thank you, it's all meant to be generic. There's never any identity in my images. Mm-hmm. It's meant to be generic to the human condition, to allow somebody to see something that they have never felt before or that they have never imagined as possible before.
It's fun to go to one of your shows and eavesdrop on the conversations because, knowing your work like I do, to watch people react to the images and try and figure out, is that an elbow? What is that? And that's really fun too.
Oh, some fascinating stories over the years. I had a show about 8 years ago, I think, and a woman would come into the gallery. I don't know if you ever heard this story. Elderly woman came in with her walker every day to the exhibition and stood in front of one photograph. It's a photograph that happens to be my niece, close-up of my hours-old niece being cradled by the hands of everybody else, her older brother, her mother, her father. And all the hands of the rest of that nuclear family are encasing the newborn baby in a cocoon of love, if you will, right? And so this woman came into the gallery every day, and she stood in front of that image for 5 or 10 minutes, the gallery owner told me, and then she would leave. And finally, the last day of the show, I happened to be there. We were trying to plan the takedown of the show and all that. And the gallery director said to me, that woman over there, she's been in here every day. You might want to go talk to her, right? And so I went up and I said, ma'am, I'm the artist, and I understand that you have aligned with this image. And she said, I was the 11th child. There was 9 years between me and the 10th child. She said, nobody wanted me. Nobody wanted to play with me. Nobody wanted to be with me. Nobody took care of me. I was the unwanted straggler at the end of a very large and stressed family. And your photograph represents all of the love that I have never had. And I welled up with tears. I didn't know what to say. She turned around and very quickly walked out of the gallery. And I was sort of stunned. And then I thought, oh my God. And I grabbed the image off the walls and I ran out onto the streets to give it to her. And she was gone. I don't know where this 80 or 90-year-old woman went. There weren't any alleys she could have gotten into. I don't know which door for which building or shop or home she slipped into. She was gone.
Wow, that's very powerful.
And she did not come back the next day. I went at the same time. And so I love producing imagery that pulls at people's heartstrings or allows them to feel things or allows them to see situations that they would never permit themselves to see otherwise, or inspires them to some other way of handling issues or problems.
Yeah.
So that's the bigger point of the photography, but it's all done through the vehicle of anatomy, through the vehicles of social prejudice or through the vehicles of
I have
emotions
a
or
worldwide
psychology.
audience listening. Are there particular museums or galleries that are permanent collections that people might, just off the top of your head? I'll put a list on the Hey Human website.
Well, there are a number of museums. Probably the biggest chunk that's in a prestigious big international museum is at the Art Institute of Chicago, the Museum of Contemporary Photography, the National Portrait Gallery in Washington, the Canadian National Portrait Gallery. Galleries around the world have shown things. I don't know. I'm sorry. I'm kind of on the spot. I'm not.
No, it's okay. I didn't expect you to be able to name all of them.
It's probably it's all this is on my own website.
Yeah,
I'm sure
on your
someplace.
CV. Yeah. David, this is an extraordinary conversation. I mean,
well, you baby are pretty remarkable. You pulled all the cool stuff out of me. I don't know how you did it, but you did it.
Yay.
Yay.
Thank you so much.
Don't tell anybody I love you too.
Yay. Well, now I have it on tape, so.
Maybe we should make some kissy noises. Maybe not.
Don't want to make other people jealous. Yeah. David, thank you. Dr. David Teplica, your website is?
DavidTeplica.com.
Very easy to
or
find.
The 803, it's 803 Foundation, 803foundation.org.
Yes. And thank you for saying, I know you're so busy, and I'm just delighted that you took some time to talk.
It's my honor.
Yeah, so thank you.
Thank you very much.
Yay! Bye, everybody.
Did you hear a kiss?